Hi, Michelle. It's nice to see you again.
Hi, nice to see you too.
So what brings you in today?
Well, came in today because I haven't gotten my period this month and took a home pregnancy test and it was positive. So I came in to see if I really am pregnant and talk about having an abortion.
Okay. The pregnancy test we did here today also shows that you're pregnant.
Yeah, I wasn't trying to get pregnant. My partner and I were using condoms most of the time, but I'm just not in a place right now where I want to have a baby.
Sure, and that's common. Many people get pregnant at a time that's just not right for them.
Yeah, I've thought about it and it's just not something I want right now.
It seems like you've made a decision. So what would be most helpful for you right now?
I'd just like to know what the next steps are so I can have the abortion as soon as possible.
Okay, I can let you know your options, but they depend on how pregnant you are. You said your last period was about a month ago?
Yeah, a little over a month ago.
Okay, so it's likely to be an early pregnancy, which gives you two main options.
Got it. I don't know if you remember me telling you this, but I had an abortion about a year ago, the abortion with the pills, and it was fine for me to do it that way, but I just wanted to have a refresher and hear what my other options might be.
Yes, I do remember. So the first thing to keep in mind is that either the abortion with pills, which is sometimes called a medical or medication abortion, or an abortion with a procedure are safe, and neither should impact your ability to have a child in the future, if that's something you decide you want. Neither will cause long-term problems for you, and they're equally effective. So the decision between one or the other is very much a personal decision.
That's good to know. So how do people decide?
Well, when patients tell me why they chose either option, it's usually because they want to have the procedure be done and walk out of the office not pregnant, or they want to be able to choose when they take the pills, where they want to be, at home or in a comfortable environment, and who they want with them, if anybody.
Well, I really liked being at home last time, but might also be nice to just get it done now. Can you tell me more about what the whole process is like for each option?
Absolutely. With the pill abortion, first you take one pill called mifepristone, which stops the pregnancy from growing. You can either take the first pill here in the office or take it at home and swallow it in the next few days. Then about 24 to 48 hours later, you take 4 more pills called misoprostol, which cause cramping and bleeding and complete the abortion. Does this make sense so far?
Last time I had to take the first pill in the clinic.
Yeah, so there have been some changes to how the medicines can be used. This gives you a little more flexibility.
Okay, got it.
2 to 4 hours after you take the second set of pills, you'll start to have cramping and bleeding. If you do decide to use the pills again, we can discuss some of the logistics about when is the best time to take them, like your work schedule, access to a bathroom, do you need to keep it private, that sort of thing. Do you remember how it felt for you the last time?
Wasn't that bad. It was like having my period, just the cramping was a little worse. The bleeding did last a while though.
Yeah, it's usually strong for the first couple of hours. I can give you some medication to help with the cramps and bleeding. After the first day, people usually bleed off and on for a few days, but for some people, it can continue for a few weeks.
Got it. It's basically what I experienced. What about the procedure?
An abortion procedure can be done here. It starts like the pap smear that you had last year with an exam to feel the position of your uterus. Then I would use a speculum so I could see the cervix. And then I'd use small rods to stretch the opening of the cervix.
Is it painful?
This part may feel crampy. People can experience this differently.
Okay.
Then I would use a small tube and gentle suction to remove the pregnancy. The whole process is about 5 to 10 minutes.
Oh, I didn't realize it was so quick.
Most people think the procedure takes much longer. Most of the bleeding and cramping happens on the day of the procedure. You may have light bleeding for up to 7 days, but for some people, it may continue off and on for a few weeks. If you were to do the abortion here in the office, we would give you some ibuprofen pills and some numbing medicine in the cervix to help with the cramps. There are other places where you could have the same procedure with anesthesia if you chose.
Okay, got it. Is this as safe as the pill abortion?
Yes, both the abortion with pills and the abortion procedure are equally safe and equally effective. The choice is really yours. So what other questions for me?
Is there a cost difference between the two?
No, not here in this office.
Okay. Well, I do think I want to be at home, so I'll do the pills again, and that's something I can start today?
Yes, you can start today. Luckily, you're in a state where you can do the abortion the day you come in. As you probably remember from last time, I have to do an exam and complete some paperwork before we can get started, but we can go over that whole process together.
Okay, that sounds good.
So before we go on, I'd like to ask you a few questions that I ask all my patients. I know you've been my patient for a while now, but I'd rather not make any assumptions. I ask all patients about what might happen if somebody finds out about their decision. Have you told anyone about your pregnancy and your decision to have an abortion?
Yeah, told my partner, my mom, and my sister.
How did they react to your decision?
They're all okay with it and are extremely supportive.
That's great. It sounds like this is a decision that you feel like you're making, with a lot of support from the people who are important to you.
Yeah, I know it's what I want to do.
Okay. The other thing I usually bring up is contraception. Some people find this to be a good time to talk about what they could use in addition to or instead of condoms, and others would prefer to wait. What do you prefer?
I do want to talk about it at some point, but I'd rather not right at this moment. Can we talk about that later?
Of course. After going through the paperwork, we can talk about whether you want to come back for a follow-up visit after the abortion, which you don't need to do, or you can always decide to come in to talk about contraception at any time. It's up to you.
Okay, sounds good.
All right, let's get started.
Hey. Well, I had the abortion. I'm not pregnant anymore. No, it went surprisingly well. I feel pretty good about it. I was a little nervous at first, but I got what I needed in the end, and I feel really relieved. Yeah. I just went to my family doctor, the doctor I've been seeing since I was a kid, and she's taken care of me when I've been sick, done my shots, everything. It was actually really nice to talk to someone I know. Oh, no, not at all. Totally no judgment, even though it was my second abortion. I was a little bit worried that she might be, like disappointed in me or something, but no, she was really supportive. No, she didn't try to push me into making a decision I didn't want. I knew I wanted an abortion, and she didn't do what the doctor did last time. No, remember last time? Remember when I was away at school? Yeah. That doctor kept bringing up parenting and adoption, even though I'd already said I wanted an abortion. And this time, my doctor just gave me the information that I was asking for and trusted that I knew what I wanted. Oh, yeah. And the last time, I felt really pushed to get birth control before I left the office. I told them I wasn't ready, but they kept telling me it was a really good idea so that I wouldn't have this happen again. Yeah, but when my doctor asked me about birth control this time, and I said not yet, she was just like, okay, we can talk about it later if you decide you want to. And we moved on. Yeah, and now I'll go back to her if I decide I want it. Yeah. Great. I can't wait to see you tomorrow.
Sasha.
Hi, Mike.
Join me.
How's your day going so far?
It's good.
Yeah?
Seen a lot of patients this morning, so it's busy, but good. How about you?
Good. I had a patient this morning who came in pregnant and was really clear that she wanted an abortion.
Yeah, I often have patients like that who come in being really clear about what they want.
But it's hard for me sometimes. When I was being trained to do options counseling, we talked a lot about giving all the information about all of the options so that our patients could make informed decisions. Right?
My training was exactly like that, yeah.
But the more patients I have coming in, the more I learn from them that they really do know what they want and are making informed decisions based on their life and circumstances. Feels like my job is just to answer their questions and give them the information that they're interested in hearing about.
I totally agree.
Right?
It can be really challenging for me too. But do you ever worry about the fact that you're not giving them all the information they need?
Yeah, I guess I do. But when I give them a lot of information that they're not asking me about or that they're not interested in, I think it can sound like I'm not really listening.
Yeah.
So instead, I've been working on taking cues from them throughout the conversation. I always feel a lot better about the counseling session when I approach it from that perspective.
That makes a lot of sense. You know, that's a really, really good way of looking at it.
Thanks.